Today is Dr. Umakantha Adiga, a renowned pediatrician in Bangalore, and Dr. Zirak Marker, Senior Psychiatrist and Advisor at Mpower. Thank you so much, Dr. Adiga and Dr. Zirak, for joining us.
Thank you, Sindhu.
Thank you.
Right. So, as we were discussing, and I also mentioned in our introduction, the impact of COVID has been quite strong on children as well this time in India. The second wave has been really brutal. I just wanted to understand that, in my previous conversations as well, it has come out very clearly that the impact on children is very, very different, both physically and mentally. So would like to understand from the both of you, what are the common factors that you see and what are the differences you see with children who are impacted by COVID, whether they are impacted or whether their families have been impacted?
Probably I'll go ahead first, Sindhu.
Please go ahead, Doctor.
Symptoms, some of the symptoms are common, both for adults and children. It could be fever, cough, cold, soreness in the throat. It could be body pain, headache, etc. These are common things. But the problem in children is the way they present, in the sense they may not be able to express these symptoms properly. So fever, somebody can make out touching the baby's body. Cough and cold, it's evident. But if there is something irritating the child, like a body pain, throat pain, or something wrong, it may not present, it may not be able to convey it and talk it out to the parent. So they may present with just irritability. Child doesn't look feverish, it's quite irritable, it's crying for no reason, or it could be drowsy. Normally, child is bumpy, active, cheerful, bubbly. Suddenly goes into sleep. It's not getting up. Always sleepy, tired. These are some of the different presentations of the common symptoms. Apart from that, there could be various other symptoms which are more common in children. Very vague sometimes. Nothing else. Child has been not passing urine since past 12 hours. It's a very unusual symptom. Or it could be some unusual type of rash on the child noticed by the parent, or it could be just that child is not responding well, constantly clingy to the mother and irritable, and these things. And apart from it, I should mention something else in children. There is something called as multisystemic inflammatory syndrome in children, even though it's not very common, but it's something like an after effect of COVID. We see this after about 1 month or 2 months later on. So at this time, nobody has COVID at home. Everybody is fine. They would have had COVID 1 month or 2 months back, or it would be very mild asymptomatic one. They would have neglected. Suddenly, child has fever for 2-3 days. That develops rashes. The face become reddish. The tongue, lips, they become very reddish. There could be a lot of reddish rashes. There could be swellings of the lymph nodes, and there could be peeling of skin. And this is something which cannot be neglected. This is one small portion of children who require very aggressive and intensive care, has to be recognized very early. The earlier you recognize, the better is the treatment. Of course, once it's recognized with a pediatrician and once it's taken care, always they come out well. But somebody misses it out. They may not think about COVID at all. COVID happened 2 months back. So why it's happening now? So these things, if it's missed out, so yeah, definitely it can be difficult. And particularly in a small child, a child below 6 months, majority of them do well. 99% say, but there is 1% who present very unusually with unusual symptoms. And it is very important to keep the pediatrician in the loop, because the parents may not be able to pick up these things, or even if they pick up, they may not give much significance to these things. And always having a pediatrician in the back end is definitely important. Something goes wrong, there are few red flag signs I would like to tell. Red flag signs are the danger signs. Fever 3-4 days, nothing to worry, but fever goes on for the 5th day, 6th day, not coming down. Child who was very active in between fever. During fever, the child becomes irritable, fine. But in between fever, the child has to be calm and composed, or his usual self, bubbly and cheerful. But a child who is irritable, is drowsy, sleepy, is breathing fast, is coughing very severely. A child who is not at all eating, decreased eating is again expected. Children don't eat well, even otherwise, and during fever, they eat less. But a child who totally refuses to eat, or a younger child who totally refuses to breastfeed, something is abnormally wrong. So always keep the pediatrician in touch, and things can be picked up quite early.
Right. Dr. Zirak, how has it impacted the children differently from the adults?
Sure. So as we were just discussing, right, I mean, even WHO itself is saying that the next crisis is going to be that of mental health. And if you read, more and more research and statistics, I mean, people are already saying, and WHO also says and claims and states that India is the most depressed country in the world as we speak today, where literally this, and to start with, 50% of all mental health conditions, start at or below 14 years of age. When you look at that from a statistics perspective, where they say 1 in 6 children, between the ages of 10 and 19 have a diagnosed, aspect of clinical depression or other mental health concerns. And as we speak, there is one kind of, suicide attempt every 3 seconds and one death by suicide every 40 seconds. And that's how alarming, statistics are with regards to mental health. So I think all of us, whether we are clinicians to, stakeholders in education and parents, we need to be and have cognizance that what we've all gone through in this 1.5 years has impacted us as individuals, as parents, and definitely it's had its impact on kids. Having said that, on a lighter note, I've always said this in all my webinars, that our kids have truly been the heroes of this pandemic, right? I mean, they've had no option. They've had to get on online schooling. They've had to just adjust and accept and adapt, right, to the situations at home and the lockdown periods. And I think I would like to break up how it's affected kids, I think, in 3 blocks. So I think what's happened to kids from 0 to 6 or 7 years of age, the far younger ones, they've completely not had any social interaction. So we call it as, they've had social deprivation almost, right? And no actual stimulation. If you look at the first 6-7 years of a child's life, they say that 90% of learning and development happens by then. And for almost 2 years of their life, they've not interacted, they've not had play dates, they've not socialized, they've not gone to play school, and they don't even remember the concept of schooling at that age. So with this social deprivation and a lack or loss, like I would say, of play, which is so natural in the learning curve, there's developed a huge sense of insecurity, I would say, over attachment and anxiety. Like, I know so many parents who will call and say, we've gone just even for a drive after a really, really long time, and my kid couldn't take the sensory inputs. And if you think about it, the sound of traffic, the noise, the amount of people, the rumble and jumble that you would have, say, in a play school or a nursery or on a play date or at a birthday party, all that's missed out on and lacking. So we are seeing, like I said, social deprivation, sensory deprivation, right? Boredom setting in. And of course, when they're that much younger, kids can't really express their feelings and emotions. So it comes out like tantrums or behavioral discord and, behavioral issues then. Kids aged after that, around 8 to 12, the adolescent phase, I think what's happened to these kids is they've done 4 and 5 or 6 hours of online schooling and they've gone back to a gadget for recreation, which is so sad. I mean, instead of going out and playing sports or again, being indulgent with classes, etc., they've gone back to screen time. And I think every parent's woe is an average of 8 to 15 hours sometimes a day. Imagine 8 to 15 hours on screen, whether it's the PSP, or we're seeing tons and tons of gaming addiction, either on games like Fortnite and Minecraft. And when you look at the whole addiction concept and the symptoms based on that, there are clear changes in irritability, mood. When you take away that so-called drug in the form of an addiction, there is also aggression and violence that ensues in the home environment. So also kids who've gone through this and are going through this, they also say that they feel socially awkward. We think that this would set in awkwardness and anxiety, and they beautifully will tell you that they've even forgotten how it is to just socialize in real time. So this is their escape, this virtual world, virtual reality, virtual social interaction, to a point where they all express anxiety going back to normal life and normal school. And that's the dangerous part, the comfort level and the security that this whole virtual world and online screening has given this age group, right? And of course, with this comes, poor eating habits, poor posture. I'm sure doctor will also agree, we're getting a lot of kids with headaches, with ophthalmological problems, we're seeing a lot of pre-diabetes with, binge eating or bad eating habits, poor sleeping habits. We're seeing vitamin D3 deficiency, obesity in children, and, a whole lot of other, because I truly believe that physical health, mental health, and gut health are all, kind of interlinked.
Yeah.
And lastly, this age group has a clear issue with regards to what we call as the academic burnout. They've really been frustrated. I mean, they've really reached this sense that we don't care whether we are, and there's so much of, symptoms of ADHD that has taken a surge, because how much can you sustain sitting tolerance, attention spans, concentration levels, and focus? I mean, even whilst being online like this, kids are on other gadgets or highly, highly distracted. With the result is that there are problems with, paying attention and focusing with online schooling and education. Academics are declining, marks are declining. And of course, they've reached this sense of helplessness and frustration. Teenagers, 13 and above, up to 18, I think the problems there are social media. Like social media addiction. I mean, it's all about, again, the virtual world with the social media presence that's really, really taken a hike. The unfortunate part is the risk taking. There are so many teenagers chatting with strangers online. They've made connections with people from all over the world. And some of these are not healthy. I mean, you have chat rooms and video groups sometimes of, teenagers or disturbed teenagers encouraging other teenagers to self-harm, for example, which is such a dark way of looking at things in a way. Unfortunately, there are a lot of inappropriate sexual content being exchanged, a lot of online dating that's happening randomly and, with multiple changes, right? And these virtual relationships and chat rooms are not healthy, they're not sustainable, and not when you don't really even know what the actual age of the opposite child or the teenager is in that concern. Surprisingly, one would think during a lockdown, there would be a less of this, but there's an increase in substance abuse, whether it's smoking, alcohol, and a lot of marijuana abuse. And that's another dangerous aspect, because at the end of the day, the brain's not even developed yet completely. And when you have these aspects of a substance abuse, you can clearly know for a fact that you're worsening mental health conditions, right? And I think world over, parents are lamenting about, again, the same poor patterns of sleeping, binge eating, poor diets, poor hygiene. So skin changes, hair changes, right? And this age group, we are seeing a lot of OCD symptoms increasing, a lot of anxiety symptoms increasing, panic attacks. And of course, like I mentioned, if you hear about these horrible cases, right, where one or both parents either suffer from COVID or they've passed away because of COVID-19. And that's really, really distressing for a child or anyone to go through. So this is, in a nutshell, what we're seeing with these 3 age slots in children.
It's quite dark, and like you said, it's quite dark and very disturbing, because in the end of the day, if children aren't healthy, it makes it tougher for everyone around them, and everyone around suffers in some way. But I want to ask the both of you, physically, Dr. Adiga, I just want to understand, what can parents and caregivers do in such cases? It could be also the fact that the parents are suffering and the child may also test positive. What do they do in such cases physically? And Dr. Zirak, to you, with all the points that you iterated, what can parents do? It's a very difficult, even parents are new to this, whether it's the physical stress that comes on to the body or the mental stress that it is causing. Parents are new. There's a lot of isolation. They can't do that care that they would do when, if it's a regular cold or cough. So how does this work on both aspects? Maybe Dr. Adiga, you could touch on what can physically be done by the parents.
Unfortunately, there is no single formula or no single medicine by which we can prevent things from going to bad. And, it's a combination of a lot of good things, common sense, most important. Okay. We would tell the parents to take care of the nutrition, because during this period, people are at home, they get bored, nutrition goes haywire, they're not on proper balanced or a good diet. They go into binge eating, junk food, obesity is a problem. So those things are more on calories, less on the micronutrients, vitamins, which may be required for our immunity. So a lot of emphasis has to be put on the proper food, the good nutrition. That goes a long way. Second thing is about vaccinations. We don't have vaccinations for kids below 18 for COVID as of now. Will come shortly, maybe. But we should not neglect the other vaccines, which may prevent other diseases and thus keeping the child healthy. If it's an unhealthy child, definitely the chances of the child becoming more sick is definitely there. So always take care of the vaccines. There is a lockdown and sometimes people cannot go out, but within reasonable touch, check with your doctor, when can I come, when can I get the child vaccinated, and make sure the things are done within a reasonable limit of time so that the child is otherwise fine. And one important thing about prevention is to teach the child how to have good habits. This is in the physical sense of thing. So as you know, the final defense against the virus is the mask, sanitization, and the hand hygiene and distancing. But children less than 2 years, definitely we cannot ask them to wear the mask. That can be counterproductive because they may pull the mask, they'll chew the mask, they don't know anything about that. Children between 2 to 5 years, maybe if they're quite okay with that, there depends on child to child basis. They can accept, they can learn, they can teach them. Children more than 5 years, definitely they can wear the mask when they go outside. So we should teach them the proper way of putting the mask, and parents has to be the role models. Somebody puts a mask here and ask a child to put the mask, obviously is going to do the same thing. And even though if 75% people are wearing the mask, they're not doing it correctly. You see people often pulling this. This is the worst thing to do. The virus on the mask comes back on your hand and it's just waiting for it to enter inside. So never touch the front portion of the mask. Any adjustments you have to make, always through the strings which are behind the ear or those behind the head, they have to be handled, and never the front of the mask. And keep changing the mask as required. Cloth mask can be washed. Surgical mask has to be discarded after 8 to 10 hours or a single day use. And other thing is the habit of touching the face. We feel we are doing something, automatically the hand goes here, does something. And as a doctor, I'll tell you, it was very difficult for me to stop that, but I did it. I mean, it was quite difficult. The moment I tried to stop it consciously, something is itching in my nose and I have to touch my there. But you can teach your habits and you can teach your mind, and that we are supposed to teach our children also, particularly the older group, more than 5 years. And as Dr. Zirak was telling, it's been almost 1.5 years. Children are staying at home, and it's very difficult. Ideally, they have to stay at home when the infection is very high, as it was in the last month or so. But things may get relaxed once the lockdown has been taken over and things are getting unlocked slowly. So in such cases, the child may want to go out, go for a walk, or go in some other place. Make sure you always take the child to a well-ventilated and open space. The chance of acquiring infection is always less in a well-ventilated open space, and always accompany a child, because you do not expect the child to maintain the social distance. The moment he sees his old friend, he runs to them, he hugs them, and he just starts playing. So you have to be there to ensure things are taken care of properly. And another thing is, as much as possible, avoid gatherings, meetings, and functions. It may be a family function. We tend to feel it's a game the mind plays. We tend to feel this is my brother, this is my family, they are safe, they take precautions very well. So there is nothing going to be a major harm if 4 of us from different families are together and we have a small birthday party. But in that family, one of them may have another member in the family who doesn't believe COVID is existent. He believes all this is a big rubbish, and he believes in not wearing a mask. And that person may bring the risk to your house. So as much as possible, keep these meetings, at least when the disease is at its height and peak. Avoid these things. Go for virtual meetings. Be in touch with your family through the various other medias and virtual meetings. And I think Dr. Zirak will talk more about that. And just in case somebody is positive at home or somebody has symptoms at home, and nowadays we have nuclear families. Suppose one parent develops a symptom, if possible, try to isolate on day 1 of symptom, because waiting, thinking that this symptom could be because of the weather change, it could be because of the rain, it is because of the Coca-Cola which I had yesterday from the fridge, all this is very, very common, and every person will attribute the symptoms to these things. So isolate on day one, get it tested, even though it means unnecessary couple of tests. It's always better to be safe than to be sorry. So isolate on day one, keep your child as away as possible. But if it is a very small child, it usually prefers to stay with the mother. So if it's a breastfed child, we cannot do anything. Mother has to feed the child. She can continue the feeding, let her wear a double mask, let her keep her hands clean. And if it's a very small baby who doesn't move around, the baby can be kept in a different room. And during feeding, it can be taken back and fed. But if it's slightly older child, those which are between 1 to 2, it's very difficult to isolate them from the parents. So we cannot do much about that. We have to let the child be with the mother. The mother is affected person. Make sure the room she stays is well ventilated. I always tell ventilation. Ventilation is something which is very important, reduces the risk of the transmission to a significant extent. So let the child stay in a well ventilated room. But if it's an older child who can manage, somebody who's more than 8 years or 10 years, if the child is confident of managing, always be in touch with phone or some other communication and try to isolate. But in case both the parents are sick, again, it's very, very difficult. I advise people not to do one thing. In the nuclear families, both parents are sick, the test positive, child might have been negative. They send the child to their in-laws house or the parents' house. This is something which should not be done. A child may test negative in the early days, it may come positive later, or it may be a false negative also. So there is always a risk for the child carrying the infection to the elderly parents or elderly in-laws. So that is more dangerous. In that case, nothing much can be done. As I told you, take safety precautions of wearing a mask, good ventilation, and cleaning your hands when offering the feed to the child or preparing food or handling the children. So these are the precautions which can be done by the parents to reduce the risk of infection. And if at all infection is there, to take some precautions so that it doesn't spread. Thank you, Cindy.
Right. That's just, it's like you said, there is no single answer. There are multiple things that you just have to do, and none of us seem to have choices there. But Dr. Zirak, like we rightly said, if both the parents do test positive, the child also has a lot of anxiety because they are watching the news, and children are actually quite intelligent and aware of what's happening around them. It's not like they do not know what's happening. They do know what's happening. They understand things as much as we adults do not want them to understand. They do figure out, they have sensitivity of understanding what's happening around them. And you did point out several issues that you have seen in these past 1.5, 2 years. Just want to understand what can be done in such cases. How can parents work around it? Because mental health, as you rightly said, in India is not something we're used to dealing with, right? So how do you deal with it then?
Oh, so two, three things. One is, I think all of us again need to be aware as to what some of the mental health risk factors are, right? When we look at those risk factors, because I truly believe in anything that's mental health or physical health based, the earlier you intervene and use preventive measures, the far better than, the prognosis and the recovery and the treatment. It's the same with any, like I said, mental health or physical health aspect, right? So when I talk about risk factors, of course, it's the stress. I think all of us are going through stress. But then when you know that, say, a parent, for example, maybe having a mental health concern or another physical health concern, sometimes we do know that right now, jobs, pay cuts, losing jobs, financial insecurity, those are clearly high risks. I know so many families have had to even sell their homes or businesses to just, kind of stay afloat, so to speak. Or when there's a family history, genetic history, any kind of history of drug abuse or alcoholism in the house, any chronic illness. Sometimes we clearly in this year have seen that physical abuse, verbal abuse, sexual abuse, all these are on the rise. Between families, adults, if there is disharmony within a family or a joint family, obviously this is not a normal way of living, right? I mean, there's no privacy, no space, no outlets. So family conflicts have also completely soared up. We've seen a spat of, divorces and, impending divorces increasing when couples have realized that they can't seem to kind of live together, etc. So if these are those kind of underlying factors within a home, within a family, then of course, as parents and family members, we need to be more aware that this could be or pose as a risk then for mental health concerns in their children. Or I think mental health itself is a spectrum, from wellness on one end to a typical psychiatric disorder or a diagnosed illness on the other end. Having said that, one can't just shy away from waiting out till it reaches rock bottom. And I say this again, citing another statistic, they say that by the time mental health symptoms emerge in a child, and by the time the child or the family starts reaching out for help or the treatment starts, it is 8 to 10 years. Imagine 8 to 10 years with the onset of particular symptoms and the treatment that starts. And this is because of what you rightly said. There's still such a, kind of a taboo and a stigma attached to mental health or going and seeing a mental health professional or a psychiatrist. I mean, the word mental itself it's got so many negative connotations, right? And I think from a parent's perspective, I think there's an inner feeling of guilt. You don't want to address it. Sometimes you don't want even to share with other family members that your child is perhaps going through something or you're going through something. And the concept of it's a phase, it will pass, and all those aspects. And I tell this to all parents that if your child has a tooth that's getting infected and needs a cavity fill, you will not hesitate but go immediately to a dentist, right? And there are specialties like that. So when there are emotional, psychological setbacks, why not go to a specialist in this field, And the other taboos and stigmas are you'll be labeled, you'll be judged, once you go to a psychiatrist, you'll be put on medications. And all this is untrue. And now things have evolved, from a medical and a scientific perspective, even with treatment paths. And thirdly, I think when you get over that phase and you have the cognizance that, you or your child and the family needs the mental health support, counseling or psychiatric services, I think the question that comes to many families or parents is, when do I need that help? And that comes with what are those warning signs or red flags, right? And the answer is, again, quite clear. We all go through emotional setbacks in life, right? I think each of us in our own way have had our struggles this year emotionally with relationships and other factors. Counseling helps, right? Counseling is not just sitting and chatting randomly with a professional or just sharing all your problems. Yes, sharing is one part of therapy and counseling, but I think what the therapist also helps you to do is navigate your thoughts, give you another perspective of your problems, tries to give you healthier coping mechanisms during distressful times, right? And of course, teaches you what we call as eventually resilience, which is the inner strength to not just be able to cope with life's challenges and hurdles, but I think even emerge stronger, right? So that's if it is emotional and psychological need. Of course, if there is something clinical, now when I use that word clinical, there are certain neurochemicals in our gut and our brain. The most widely researched ones are serotonin and dopamine, which basically help controlling our moods and actions. And when there is a disruption or an imbalance in serotonin especially, it then of course causes clinical symptoms, either of anxiety or depression or bipolar disorder, and in severe cases, even schizophrenia, right? Now, when I use that word clinical, it means it is not emotional, psychological, or externally based, but an internal imbalance, like how we would diagnose an imbalance in blood sugar levels, right? Or it would be the same with a cholesterol level that goes suddenly up. And when these are clinical manifestations, it obviously needs pharmacotherapy or medication then to treat those imbalances. So that's how you holistically treat a mental health concern in a child or an adult, with medication if it's clinical, or then with therapy and counseling if it is psychological and emotional. With children, if symptoms persist, so for example, if there's a consistent feelings of sadness, lowness of mood, irritability, mood swings, parents say that the child has suddenly changed or slowly changing over time in the way the child is interacting, behaving, social skills seem to be withdrawn. Suddenly parents will tell us that there is an ebb down or a lack and loss of interest in almost everything, even in the fun activities, with withdrawal behaviors as well. changes in energy levels, feeling tired all the time, or psychosomatic symptoms, vague symptoms of headaches or backaches, or feeling dizzy or feeling anxiety, things like that. Low levels of motivation, like I said, completely unbothered with academics or with marks or with meeting friends, feeling overwhelmed and hypersensitive about, very small issues. Children who express a sense of helplessness, hopelessness, worthlessness, and sometimes that can spiral into kids actually voicing suicidal ideations and thoughts. It reaches to a point where they feel there's no other hope left, right? And of course, with these kind of red flags and warning signs of depression and anxiety comes a lack and loss of, focus, concentration levels, attention spans in class. And clearly, even in a school setting, teachers can sense that there is a change, right? And of course, if there are actual suicidal thoughts and ideations, usually children and teenagers voice it to a friend or a family member, or then to a school counselor, because I think there is fortunately lots more awareness about these things. And what we tell all parents and professionals and doctors, that if you get the warning sign or the sense or the gut feeling that this child is thinking about harming himself or hurting himself, you need to ask. You need to ask. It was a theory long time back that, don't ask children about suicidal ideations and thoughts, because it would plant wrong ideas in their minds, so to speak. But that has completely been thrown out from even research. In fact, research will tell you, even from the Youth Mental Health First Aid Organization in Australia, they encourage teachers and even school counselors to directly, openly and honestly ask children or teenagers if they feel like harming themselves or hurting themselves, because that could just, like I said, open up a whole conversation and you could very well save a life. Right. So from what you asked me in what we can do as parents and families, I think being vigilant, you can't be just so embroiled in your working from home that you're not being present. So mindful parenting. So be engaged, be involved, and be present. I can't be having a conversation with my kid while I'm punching away an email or texting someone on my phone. Even just sometimes looking at your child's body language. Parents don't even, we get so caught up in life that we forget to look at our children. And simple things like, no devices on the dining table. I mean, there's so many beautiful aspects of this lockdown, right? I mean, as fathers especially, we're getting so much more quality time with our kids. We're being able to put them to bed. We're being able to come home. I mean, just be home with them, have family meals together. I think also the collective responsibility the doctor also brought up for being safe, being indoors, not randomly socializing. I think the more the feeling and the sense of collective responsibility come up, I think children, like I started saying, are far more adaptable and acceptable to these. And when acceptability and adaptability come into play, I feel that brings up resilience. I tell parents to celebrate everything, the smallest of achievements, whether it's in school, whether it's holidays, festivals, birthdays, New Year, Diwali. Make the best, right? With creativity, with humor, but still maintaining balance. I think balance in everything from work, studies, screen time, diet, sleep habits, gaming, exercise. All this needs to be structured. As parents, you can't turn a blind eye and let things all go haywire. So balancing time management, organization, and structure to maintain all of this for yourself and for your families is of absolute importance. And lastly, I think we need to stop over talking and communicating to kids about the COVID and the death. I mean, as there's so much happening with news channels and conversations that kids are picking up, and we can't underestimate the anxiety it builds up. I mean, I thought I shielded my 9 and 7-year-old beautifully, but recently they've been just breaking down in the nights before sleeping and asking these questions: that what if you die? What if you and mom get COVID? Who will look after us? I mean, imagine a kid feeling like this when we really tried hard to shield them, right, in a way, from all the information that's dark out there. So allow for important age-appropriate communication. Allow them to express and feel and emote, and having these meaningful conversations are really, really important for their psychological well-being and security. And lastly, teach kids gratitude. Thinking of the smallest of things in life that we so take for granted. This is the best opportunity to capitalize on. And I say this to all parents, maximize emotional intelligence at this stage. You have so much of quality time and meaningful conversational time that infuse the concepts of gratitude, empathy, compassion, respect, right? Those are the best teachers we can be for them, to instill all this for them. And at the end, that's what we want, right? We want them to be happy human beings, high on EQ, right? We so focused on, increasing their IQ levels and increasing their marks and making them first rankers that we forget to educate their hearts.
Right.
And I think that is so, so important today, and more so in times like this. We have to prepare them to be emotionally healthier and more resilient to take on whatever life throws at them.
Great. Thank you, Zirak. So we're running closely out of time. But before I go, I want to ask the both of you, Dr. Adiga, starting with you. A, what is your key learning from this pandemic? And B, how can we continue to remain safe in times like this, not just for ourselves, but even our children?
So one thing is never underestimate the present virus. We did it in the second wave, and we didn't expect such huge numbers. We thought we are through it, and so that shouldn't happen again. Always, it's better to be prepared, even though we are on the right side. That's always better. And second thing would be as we have seen, the final defense is just the mask, the social distancing, and the clean habits, which are more important. Vaccines definitely they do play a role, but there is a lot of issues with that. We don't know when people are going to get vaccinated in an entirely larger scale, and it may take time also. So till then, our final defense to this has to be the SMS. And one more thing is to never be in denial, because everybody thinks COVID is not here. It's there next door, or it's in the next road. But something happens at home, people are not ready to accept it. So never be in denial. Any little symptoms or signs, always act very swiftly, isolate yourself, get yourself checked so that it doesn't spread. We keep hearing these stories again and again. They repeat. Things happened 1 week back and they come to us after 1 week. By that time, the entire family is affected. So always act swift and take the precautions at the earliest. And another thing is not to panic. We hear all the bad stories and sob stories, but still there are 98% of other people who are just had COVID and suffered for a couple of days and they're okay. So that's what is going to happen for most of you. So don't get bogged down. It's may come someday, but it's most likely that you'll go through it without any major issues and damage. That would be the key take messages for me.
Dr. Zirak, your learnings from this pandemic.
I think my personal learning, this year has been what I call as the silver lining concept, which is, constantly trying to look for the positives amongst all the chaos and the negatives, looking for good with situations and within situations and people, not just focusing and festering our thoughts on the negatives, being more optimistic and hopeful rather than constantly generating, pessimism and negativity. I think it's so important to navigate our thoughts so that we can garner different perspectives and perceptions to our problems. Because when there are hurdles and problems which we all will face in our life, it is about how do we generate a solution rather than just constantly focusing on things that we can't control or we don't have control over. Shifting the perspective to generating solutions so that we can all, as I said, garner healthier coping mechanisms. And I think all of this leads to the key word, which is building up more and more acceptability to situations in life, therefore more adapting, that will increase and further build our resilience, not just in us as adults or parents, but it will even then, transmit into our children. So that's what I kind of encompass that, and I call it the silver lining concept in my own words. But And I think we need to teach these things to our kids and the next generation. And not just because we've gone through this year and this pandemic. I think these are hard lessons of life that we need to instill and inculcate into our children for better or worse.
Great. Thank you so much. Thank you, Dr. Adiga. Thank you, Dr. Zirak. Thank you so much. I hope parents take away as much as they can and they reach out early in both cases, in both the physical symptoms and as well as the mental symptoms. They reach out early. And anyway, Project StepOne is there, Mpower is there, Mpower also is there. There are many platforms and there are many places people can reach out to. So thank you so much. Thank you for talking to us and giving us as much of information as possible. Thank you, Dr. Adiga again, and thank you, Dr. Zirak.
Thank you, Sindhu. Thank you, Dr. Zirak. A lot of learning from you.
Nice meeting you all.